thank you so much for giving me a warm welcome here to Tanzania. It's been on my list for a long time to come here, and I'm very happy to finally be here. I'm now in my 10th year as a special representative for UNAIDS. I have traveled to many countries with UNAIDS and seen the burden of disease in many countries. So it's been specifically rewarding for me to have a program here in Dar es Salaam today. I've been very impressed with what I've seen. My story working on HIV/AIDS related issues started 15 years ago when I got married to my husband, and we decided to set up a small foundation and decided that the money should go to health and education abroad. And when we looked closely and more closely into those issues, obviously HIV/AIDS came up as a very big issue that we needed to tackle. I then went on to work as an intern at NORAD and was able to look even more closely at the epidemic. And I've been fortunate enough, as I said, to work with UNAIDS for 10 years. And for me, it's a special thing to be here in Tanzania and in Dar today, seeing how far we've actually come. So when I came to Pasada and saw the list on the wall of all the services that Pasada actually provides to patients living with HIV/AIDS, it's a different world than I've seen when I started this work. Today, when you come to a clinic, you know that there is hope for you. You know that there is access to medication. You know that you can get help through your pregnancy. You can get help so that your children are not affected by the disease. You know that if you are a young person and you have the disease, there is counseling for you. How to tackle and deal with being HIV positive. You know also that there is many of the big organizations around in the country that will actually listen to you and hear your voice when you're a young person, which was not the case only a few years back. So I think we've seen huge progress, but that can't stop us from remembering that we're not there yet. And if we are going to continue to fulfill our promises towards 2030, I think the international community has to really step up and now acknowledge the fact that we can't think that HIV/AIDS is a solved issue and that it doesn't exist, because it acutely does for the many people who does not have access to medication, who does not receive the counseling and they need. And I think this is something that all of us have a part to play in when we look at our roles in fighting the epidemic, that we also, all of us have to acknowledge the fact that the fight is not over. I've been very impressed by seeing the work here today by civil society like Pasada. And one of the things Pasada does is they give counseling to young people. A lot of the young people we met today were orphans, AIDS orphans, and were HIV positive themselves, and were receiving training in entrepreneurship. And I don't think I've ever been to an AIDS clinic who offered those services before. And for me, to see that there is actually hope for young people living with HIV/AIDS, that some people are willing to work on their private time to give them education so that they can find ways of getting work for themselves so that they can establish a livelihood for themselves, was very, very moving. And I must say, I think the stark contrast from when I visited Malawi a long time ago, when I met mothers who were sitting with babies in their arms who we knew did not have access to medications. The mother did not have access to medication. And to see this little boy today who were so happy to fall asleep on my lap, but that he was not infected with HIV. His mother was doing fine on medication, is, like you said, a terrific example of how far we are actually, but we also cannot forget those who are not in such a fortunate position.